Hi guys, so welcome to our channel All Around Health Talk. Today we're going to continue with vaginal infections. Last week we spoke on the different types and their characteristics. Today we're going to be talking about the diagnosis, the prevention and treatment of these vaginal infections. So we're going to go straight to diagnosis. How do we diagnose these vaginal infections? From our last video, remember that we spoke about 3 main vaginal infections and their characteristics. So one of the ways of diagnosing these infections will be through the symptoms, the signs and symptoms of this infection, which you already know from the last video. If you haven't watched our last video, please watch the last video so that you can get more information on the symptoms of these vaginal infections. So talking about the symptoms, we spoke about specific characteristics of each one. So if you complain of a white solid discharge that has no smell but has intense itching, the first thing your doctor will think of is the candida infection or the yeast infection. If you come complaining of a discharge that is yellowish green, that has a bad smell, and he examines you and sees that the walls of your vagina and the neck of your womb has strawberry looks like strawberry, he's going to suspect trichomonas infection. And if you come with a discharge that is grayish in color and smells like fish, the first thing he's going to think of is the bacterial vaginosis. So the symptoms are very important with diagnosis. Apart from symptoms, the doctor would also have to ask you questions, do what we call in medicine interrogation, to ask you about your hygiene, about the frequency with which you usually have these symptoms, when they appeared, if you've used IUDs and other means of contraceptives. So these are questions he will ask to better orientate himself with what you have. Apart from that, we have the physical examination, where the doctor examines your private part to actually see for him or herself the kind of discharge, the characteristics of your vaginal wall. Another way your doctor can diagnose your vaginal infection is also through physical examination, where your doctor would need to use a procedure called speculoscopy, using a kind of device that helps him to visualize your vaginal walls and also extend to the neck of your uterus to be able to see the characteristics of the infection that you have. Another way apart from physical examination would be the pH. Okay, during this speculoscopy, the doctor would take a specimen of the discharge, and then with specific microscopic studies, they would also check for the pH level of this specimen. Now, when it's a candida infection, your pH level is generally less than 4.9. okay, it's considered to be normal between 4 to 4.5. If you have trichomonas or you have bacterial vaginosis, your pH level is going to be way higher than 4.9. So that's another way your doctor tells that what you have is not a candida infection, but you have something else. Another means of diagnosing would be a microscopic study using 10% of potassium hydroxide. We put this potassium hydroxide on the specimen, and immediately we get a fishy smell. Okay, that confirms that you have a bacterial vaginosis. Now, these tests are not effective alone. You have to combine the various tests. You cannot just focus on the symptoms. You have to combine the various tests we've mentioned, or the various means we've mentioned, for you to have like an accurate diagnosis of the vaginal infection. So this is all for diagnosing vaginal infections.
The next is treatment. When it comes to treatment of vaginal infections, it depends on the cause of your vaginal infection. As we know that there are different things that can cause vaginitis or vaginal infection. You have the fungus, you have the bacteria, virus, etc. But when you go to the doctor, he has to first find out what is the cause of your vaginal infection or inflammation of your vagina. If it finds out that it's a bacteria, he would have to give you antibiotics. If he finds out it's a fungus, he would have to give you antifungal drugs, sometimes even antiparasitic drugs. There are some antiparasitic drugs that have antibacterial effects that we can combine with other drugs to help fight this infection. If your vaginal infection is due to your estrogen levels, for example, during before puberty, during pregnancy, or after menopause. He or she might have to prescribe hormonal supplements for you like estrogen in order to help combat this condition. And if your vaginal infection is due to your lifestyle, like irritation, allergies, then you would have to eliminate the cause of that allergy or irritation. So generally, the doctor has to first determine the cause of your vaginal infection before he or she can treat it. Now, how do we prevent this vaginal infection? First of all would be abstinence. This is usually in case of adults who are not sexually active. They would have to refrain from having sexual intercourse in order to reduce their chances greatly of having this vaginal infection. And for those who are already sexually active, well, you would have to practice a safe sex practice where you need to use a condom. Each time you have a sexual intercourse, you have to use a different condom. This reduces your chances of getting vaginal infections, whether it's anal or oral or any other kind. Yes, you have to practice the safe sex. If not, you are increasing your chances of getting vaginal infections. Now, this does not eliminate your chances of getting vaginal infection. It only reduces significantly your chances of getting these vaginal infections. Next would be good hygiene. Now, there's a point I want to get across. Most people think that vaginal douching is a really great way of taking care of a vagina. No, that's not it. In fact, vaginal douching is one of the factors that increases greatly your chances of getting vaginal infection. As she has said, pH, the vagina has a normal pH range, and anything that disrupts that normal pH range increases your risk of getting vaginal infection, because when it comes to pH, it's very, very important. That range protects your vagina. Your vagina is quite capable of cleaning itself. That's why you have the normal vaginal discharge. If you put any chemical there, whether the vaginal douches or the soap or detergent, that might alter the normal pH of a vagina, causing you to have high risk of developing vaginal infection. So it is not advisable to use vaginal douches for hygiene. Now, it is recommended to use warm water alone. Shocker, alone, to clean your vagina. And you don't even have to like spray the water up inside the vagina. No, just the entrance. It's okay. Your vagina is like a machine on its own. It can clean itself. You don't have to go and be doing it to know. Please, just the entrance with warm water and you're good. That's all. Thank you very much. Other extra practices that you can adopt is try to use inner garments that are made of cotton, because other materials tend to be too tight and tend to be too kind of trap air inside. So like it doesn't give your vagina a chance to breathe. So you need undergarments that are made of cotton, because this helps to also allow free air into your genital area, and then helps to prevent mostly yeast infections. And try to not use things like tight jeans or spandex materials like that, especially for a very long time. This increases your chances of getting mostly yeast infections. And next is there are also studies that show that reducing sugary foods also helps in reducing your chances for developing vaginal infections. And then you have to try to get regular checkups, especially if you are sexually active. This is something that you have to discuss with your doctor to know at what intervals you need to come for checkup. If it is once a year, once in 2 years, you have to sit down and talk with your doctor. I know that it can be very, very uncomfortable sometimes to talk to your doctor, but there's no shame in actually being honest and upfront with your doctor. It's actually for your benefit. So please sit down with your doctor and talk to him or her, so that you can come up with a plan on how to get your regular checkup. So that's all for vaginal infection. I hope you guys have learned a lot about everything that we've said, and I hope you also practice it. Not just hearing, you have to also practice it and take action. Our next topic is going to be STIs, which is something that is very, 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 very important in our community. So we're going to be starting with gonorrhea, which is one type of STI. Don't forget to like, comment, subscribe, and share to others. This information is very, very important. Like as we've said, it's not just important for ladies, it's also important for guys. So please try to share to every person you know about this information. It will be really, really helpful. And don't forget to also check out our Instagram page or at All Round Health Talk for extra stuff. So
keep sending in your questions also.
Yeah.
Okay, so
yeah, the Q&A. Don't forget that. Send in your questions, DM us, Instagram, Facebook, YouTube, whichever medium you feel comfortable sending it through, please.
If you want to call me and ask the question, you can call me.
Yeah, well, she has to drop her number first, you know, that kind.
If you have my number, you can call me. That's just what I'm going to say.
Okay, yeah. So see you guys. Bye.
Bye.